Good afternoon, everyone. I'm Friesen, Manitoba's Health Minister, and I'm here with Brent Roussin. Dr. Roussin is Manitoba's Chief Provincial Public Health Officer. We're here at 1 o'clock for a briefing on a Sunday, which is somewhat unusual. We always said that with this new format, we are really committed to making sure that we have good and timely information for Manitobans, and that when it was required, we would also have a weekend briefing. And so that is what we are doing today. So without any further delay, I will hand things over to Dr. Roussin.
Thanks, Minister. Good afternoon. The current 5-day COVID-19 test positivity rate is 2.7%. 72 new cases of the virus have been identified as of 9:30 a.m. today, bringing the total number of lab-confirmed cases in Manitoba to 944. The data shows there was one new case from the Northern Health region, one new case in Interlake Eastern Health, 45 new cases in Prairie Mountain Health region, 16 new cases in the Southern Health, and 9 cases in the Winnipeg region. There are 6 current hospitalizations with 1 individual in intensive care, 247 active cases, and 537 individuals are listed as recovered. The number of deaths due to COVID-19 remains at 12. We have been seeing less non-epi-linked cases over the last week. And certainly, though, that's an indicator that we follow closely. Testing numbers show 1,839 lab tests were performed yesterday, bringing our total to 125,300. Our preliminary investigations indicate that 47 of the 72 cases in the Prairie Mountain Health region are linked to intentional testing campaigns related to known clusters in communal living communities. It means that public health is being proactive and is identifying cases early, having them self-isolate, and performing the usual contact tracing. These testing campaigns are indicative of the fact that these communities are being cooperative and working with public health to try to limit the spread of this virus. The Northern Health region case is linked to previously announced cases in the Prairie Mountain Health region. Prairie Mountain Health region has been elevated to the restricted level orange according to the pandemic response system. As of Monday, August 24, masks will be mandatory in all indoor public places and at all outdoor public gatherings. Public gatherings will also be restricted to 10 people. Manitobans within the region are encouraged to take these extra provisions immediately to help slow the spread of the virus. Public health officials continue to monitor all regions with increasing cases closely to see if any other restrictions are required. If you develop symptoms, please self-isolate as soon as symptoms develop, no matter how mild they are. This means staying home, avoiding others in your household. Do not go to work, do not go to school, do not go out shopping or at any gatherings. It's important to self-isolate as soon as symptoms develop, go for testing as soon as possible, but ensure we are staying home when we're ill. Employers are encouraged to work with employees to ease the burden of staying home when they're ill. And again, we ask employers not to send asymptomatic employees for testing prior to their return to work. We know the concrete steps that Manitobans can take to reduce the spread of this virus. Stay home when you're ill, even mildly ill. Practice good hand hygiene. Don't share items with others. Practice physical distancing while you're outside of your household. And wear a mask in indoor public places. These measures have helped us flatten our curve in the past and will do so again. You can visit our website at manitoba.ca/COVID-19 for further information. Again, caution regarding stigma. We know that stigmatizing certain groups impairs our ability to address this virus. So please be kind, listen to credible information, and do whatever we can to avoid stigmatizing groups of people. So again, thank you to all Manitobans for your effort to date, and we can open up to any questions.
Is the Northern case not a First Nation?
No.
And we're hearing a push from 2 Grand Chiefs to bring back the northern travel restriction. I don't know if the minister would like to respond to that, or if you'd like to. Is that something the government is considering after the case in Gillam?
Yeah, and so these type of measures have never been off the table. We've had that in place in the past. Our response system that we have in place is, allows us to look at things like that. We certainly want to take a targeted approach as we move forward, but none of those things are off the table. So definitely have met with Grand Chiefs and discussing their concerns, and we'll continue to do so.
Dr. Roussin, can you clarify the Brandon cases? You said 47 of the 72, I believe, are linked to clusters. Is that correct? 35 are not then?
Well, 47 of the 72 cases that we're reporting today are related to known clusters in communal living communities that we did some proactive testing campaigns.
What about the other 35?
Yeah, well, we have that breakdown by region that I mentioned there. We don't have a necessarily up-to-date on the other clusters. The weekend we're working on contact tracing and things, so we just know that the 47 of the 72 are what we expected after a testing campaign.
Can you just describe for us what it's like in these communities right now in terms of, without identifying them to create stigma, but are people able to isolate properly in these communities? Is there space for them to do that? And does public health anticipate that this is going to be a concern if they're in close quarters going forward?
Well, we're working with the leadership, we work with the communities as well to advise of what is required. And, these testing campaigns indicate that there's a lot of cooperation with that. So I think that in any setting where there's close, prolonged contact, then there's increased risk of transmission of this virus. But a lot of these communities are working hard to reduce that risk.
You say testing campaigns. So are these colonies being tested en masse or individually on a voluntary basis? What's exactly happening with that?
Well, it's certainly voluntary. It's voluntary testing, but there's been on a couple of occasions mobile testing strategies to actually go into a community to assist with testing.
In the Bethesda care home situation, more cases. Are these people very sick, or what's the situation?
Yeah, and so I don't have a clinical update on here. We know there's 3 residents that have been diagnosed and 4 staff members. The residents were moved to hospital largely for infection prevention and control measures.
Jumping back to the communal living situation, what exactly is happening in these communities that's leading to this spread of the virus, and what needs to change, and what contact do you have with leadership in these communities to try and get that message across to stem this before it gets worse?
Yeah, and I think the increased amount of testing that's been undertaken is indicative of the communities taking this seriously and trying to work with public health. And so there's nothing unique, in the community that we'll see elsewhere. We'll see that the vast majority of the transmission that we see is close, prolonged contact, and that includes household members. And so if the nature of your living situation has more close contacts, then we'll see more likelihood of that transmission.
I'll also respond to this because you asked about our communication with leadership, and that's important too. And I know that public health is engaged on a regular basis with for instance, Hatarian leadership. But so is government, and even last week I was on the call with other colleagues reaching out to the Hatarian Safety Council and just building that relationship. There's just been excellent work done across Manitoba by the Hatarian Safety Council, engaging with colonies, talking about the reasons to be doing this. There's a lot of success stories out there, and Manitoba shouldn't lose sight of that. I mean, let's remember that Hutterite colonies were among the first Manitoba groups to step up and sew masks, to bring food to food banks, to supply hospitals with masks and other things. And they've been there in the past as well in the same way. So I think today it's important to reinforce that we're working with these groups. There's a lot of success happening out there. I think that it's important to look past the large number today to understand that a significant part of today's reported numbers is because there is testing going on colonies, and that's a good thing. So I think we're building relationship, we're building trust because we need it, and Manitobans have to all understand that these are our neighbors, these are our friends, and they are committed Manitobans.
How many colonies have positive cases?
It's multiple, and so there's multiple colonies that have had positive cases. Like we said, almost all are quite working with public health trying to get these numbers down.
Multiple could be 2 or any number greater than that. Can you be more specific?
No, at this point we've tried to. So remember there's a lot of cooperation, there's a lot of testing. That's the only way we could detect this many cases, because there's a lot of testing going on. Anything that we do to further identify areas to stigmatize is going to impair our ability to move forward. So we'll just we'll try to do what we can to limit that.
Prairie Mountain Health is going to be subject to tighter restrictions beginning tomorrow. Those were announced Thursday. Why the delay in actually implementing them? I know that there was a hockey tournament in Brandon, I believe, this weekend. Perhaps folks think, there's going to be tighter restrictions, so maybe this is the last time for a gathering before these come down. Is there any concern that this delay could lead to greater transmission in a place where we know community spread is happening?
And so this is always a balance, right? So we've had situations here before our phases and during our phases where we've implemented things without notice. And then the first question is, well, why didn't you give notice, right? So it is a balance. I mean, it's a fair question, but we're working to try to find that right balance. We certainly lifted the alert level because we've messaged right there, and I think most people listen to that. And then when you talk about, say for instance, the hockey tournaments and things, and certainly we've heard of these, and they wouldn't be contravening the order. They wouldn't be contravening the order come Monday either, but they're clearly against what our recommendations are. And so we need Manitobans to not have to just focus on what's allowable under order, but to start making the decisions given the context, and putting together multiple teams where hundreds of different kids are coming together probably isn't the best idea right now, whether it's allowed under the order or not.
If it's not a good idea, why not mandate that it can't happen?
Well, it's really hard to mandate every possible eventuality. Right? And that's why education is so important to Manitobans, and we have this PRS system in. We don't want to necessarily always resort to restriction after restriction. I think we're going to see this virus for a year, for maybe 2. So we're going to have to find ways to deal with this by not always having such prescriptive restrictions all the time.
Do you anticipate needing to have an isolation center like you did for the homeless community, for these communities where maybe they don't have the ability to distance properly and isolate? Is that something the government's considering right now?
Well, I say that there's a large range of plans, contingency plans that have been drawn up. I think in this case, this is not something that we have signaled to those communities that we're working on. I believe that we're still proceeding on the basis that there is the ability for those people to self-isolate where they are.
What's the weekly test positivity rate for the Prairie Mountain Health region?
Yeah, so we don't have the numbers that we can reliably share for each regional breakdown. It's there's challenges with the denominator in there as well. So at this point we don't have something that we'd want to share confidently right now.
Can you say when that number might be available for the public?
No, we've increased a lot of our reporting. We're down to that district level, so we've been working on trying to get that as much information out as we can, but I can't commit to a certain time.
There's been reports that this virus it's more virulent, I never say that word, but not as deadly as it was in the past. Is there any evidence that that's true?
That's, we can't rely on that. We'll certainly look at our hospitalization rate during our first, if we call it our first wave or first deal with this virus. So that was up at 10 or 12%, and it was like that for most regions. Where we look at our numbers now, it's far less than that. There are many explanations, possible explanations for that. One is we're seeing the virus spread in much younger individuals right now who are always been less likely to require hospitalization and severe outcomes. And so it's difficult to say. We could be looking at a lag. We know there's a significant lag period before people need hospitalization. But right now, yes, we currently see a reduced hospitalization rate than we did in the first few months of this.
And is this still the first wave that we're in?
Yeah, and it's difficult to necessarily state, if this is truly a second wave. Certainly when you plot it on a graph, everyone can see that it looks like a second wave. Normally when we're dealing with communicable diseases that are widespread, say like influenza, you'd be able to plot that graph for Canada and it would look pretty much the same. We'd see a clear first wave and then a clear second wave. We wouldn't really see that in the places around us. So it's hard to know. I'm not sure if it's necessarily important to distinguish that. It's, we're dealing with certainly a second round of cases now.
Thank you, Doctor. We'll go to questions from our reporters on the phone, a primary and a follow-up, starting with Scott from the Winnipeg Sun.
Good afternoon. I guess perhaps question for both of you. We have 500 and I think it's 560 cases since phase 4 opened up, and I'm just wondering, you guys have said all along that we have to learn to live with this virus, but I guess my question is, are we living with it in the right way at the moment?
So I think that we've been articulating. I think we've lost some track of those, what we call those fundamentals, and has brought us some increased case activity. I think again we want to try to not focus on purely case numbers. There's a number of indicators that are important to look at, and this virus is going to be here for, like I say, a year, possibly 2, possibly more. So we have to get used to seeing cases of this and not focus just on the case counts. For instance, our 72 certainly isn't a number we're used to seeing here, but a very large proportion of that was just from, a testing campaign that we expected to see a lot of numbers from. It's an isolated cluster. So yeah, I mean, I think this is kind of that wake-up call a bit to Manitobans, that we're seeing increased numbers, that we need to, again, focus back on the fundamentals. And we'll continue to follow all those indicators that we have been.
And I guess for a follow-up then, and so one of the cases aren't used, talked a lot about test positivity rate. You guys are testing more, and still that test positivity rate keeps going up. Where's the concern lie in that then right now?
Yeah, and so again, that's one indicator that we look at. And if you say look at yesterday's test positivity rate, you'll see that 2/3 of it is related to that isolated cluster. So again, it's in that context, it's not that reliable of what's going on in the province. So it's just one of many indicators that we look at.
From the Canadian Press, Rob. From the Canadian Press, Rob. From CTV Winnipeg, Mason.
So we're talking about indicators here. What exactly needs to happen in the Prairie Mountain Health region for it to become a code red?
So for the critical level, we're really going to be looking a lot on the actual impact of the transmission. So we'd expect to see much more community-based transmission than we are seeing now, not so much limited to clusters and to known cases of transmission. And then in addition, we need to see a significant strain on the healthcare system. And so we're not seeing that in our province at this point, but those are the type of things that we would look to kind of escalate our level even more.
Sure, thank you. No follow-up.
From City News, Jonas.
Good afternoon, folks. Just going to follow, I guess, for folks in Prairie Mountain, looking at the numbers again today, jumping, and wondering, for school, the orange level, when it'll trigger that level 2 for education. Any follow on that? Is that going to be an education decision? Is that a health decision? How will you guys move forward on that?
So we've, right from the beginning of this pandemic, we've been working very closely with education. So again, this is something that, public health would be advising education, and we are, advising very closely right now. So we're going to follow those numbers, and further decisions will be made. What we said from the beginning is we have to be able to respond nimbly to this. This virus is going to change. We're going to see situations change quite quickly, so we're going to have to be nimble when we see those.
So I guess what I'm trying to get at, is there a certain number, or is there some kind of indicator that, parents can say, hey, maybe we're getting close, or, how are you guys going to adjust that?
Well, I think that the elevation of the alert level to orange is one of those indicators that we need to start looking very closely at things. But like I say, it's challenging because we just can't give a black or white answer that if this happens, then this must happen, because there's just so many variables at play.
From Global, Merrick.
Hey there, America Cash from Global News. North Dakota, which is obviously smaller population-wise than Manitoba, has seen over 700 new cases in the last 3 days. How concerning is that to you guys, and how closely is the province monitoring what's going on directly to the south of us?
So we monitor the pandemic along with our colleagues at the Public Health Agency Canada for all international jurisdictions. And so, I think that when you see these numbers, and it shows the continued requirement for those type of travel restrictions to our neighbors to the south, and so we'll continue to follow that over time. But anytime you're seeing this virus being transmitted around us to high levels, we always have to be on alert.
Awesome. And just one follow-up for you, Dr. Roussin. You said previously that restrictions could start to be implemented if we hit that 3%. Obviously, we're below the 3%, but if we hit the 3%, will there be more restrictions implemented?
Yeah, not necessarily. So we follow a number of indicators, and that positive test rate is one of them. And you can see if we break down that positive test rate for for Manitoba that isn't related to known clusters, you'll see that rate be much lower. So it's just one thing that we follow, and really we could be at a situation where we see that positive test rate much lower than 3%, but require to increase restrictions. If we saw widespread community transmission, if we saw a strain on our healthcare system, we wouldn't just simply look at that positive test rate. So there are a lot of variables, and we can't just focus on one.
And from the Brandon Sun, Kyle.
Hello, Dr. Roussin. I was just wondering if you could just clarify something for me. You mentioned earlier that the majority of the cases from Prairie Mountain Health today are linked to testing done in communal living communities, and you also, I believe somebody also mentioned Hutterite colonies. So I was just wanted to clarify that those are the one and the same when you're referring to communal living communities.
Yeah, and so again, we want to advise Manitobans as best we can where the risks are, and I think announcing 72 cases without providing a bit more clarity on what's making up that, we would be doing a disservice. So that's why we announced the 42 related to communal living communities, and we want to be cautious on how much further we go. We know that stigma can play a role. We've heard about a lot of contributions from these communities. So I think whatever we can do to inform Manitobans, but at the same time try to reduce the likelihood of stigma, that's what we should focus on.
Thank you.
Thank you. We now return to room 68 and reporters on the floor. Please proceed.
Dr. Roussin, are any of the Prairie Mountain cases linked to that large Brandon business?
Actually, we don't have any link of the 72 as of yet. So obviously, we will further investigate those. We had 70 total cases related to that business, 37 of which are active.
You've reported 7 cases at Bethesda Place Personal Care Home. Do we know how many staff and how many residents?
Yes, so 3 residents and 4 staff.
And do we know if there is more person waiting for the test in this personal care home?
Yeah, I don't know the answer to that. When we discovered the first case, we did widespread testing of staff and residents there. So I'm not sure if necessarily they're all back yet, but there's widespread testing done.
And do we know if the staff work only in this personal care home or work in all the personal care homes in the area?
Yeah, so so it's very unlikely that they'd work in other care homes, and if they did, then we would be actively doing testing in those other ones. But this was kind of the purpose behind our one site policy.
Are you able to just clarify the numbers? So the colleague's just pointing out that there's some discrepancy from the release and what you said with active cases, hospitalizations, and recovered.
Okay. Yeah, I don't. We get the numbers reported out there. What was the discrepancy?
In the release, it says active cases 356.
And you said 247.
247.
Yeah. 356 is for active.
And for hospitalizations, you said 6. She says the release says 7.
6, 1 ICU?
6 and 1 in ICU. The 1 in ICU is part of the 6.
Okay. And recovered, the release says 576, and she says you said 537.
Recovered.
576.
Yeah, on the dash here. Yeah.
Recovered is 537. Which release are you looking at?
The one you guys sent us.
Are we good on the stats on this one?
I think that was it. I mean, the release doesn't give a specific number for how to rate communities, but I believe you said it was 47 in communal living out of 72.
47. Jumping back to the situation of Maple Leaf, I know in the past you had said that there was no evidence of workplace transmission. Is that still the case?
Yes. Yep. So investigating very closely anytime there had been a case identified, we're still able to link almost all of them to clear transmission chains in the community. Some not able to link to clear transmission chains, but after thorough investigation within the workplace, we can't link them there either.
So this seems like another situation where there could be perhaps communal living happening, not on the same scale as you would see on colonies, but I know that much of the employees that work there are brought in from other countries. They often, they're not high-paying jobs. They often live together. They're tight-knit communities locally. They go to the same church. Is that playing a role in the spread and in the cluster of cases that we're seeing tied to employees at a specific business who aren't apparently getting it at that business?
That's right. So we have that large cluster in the Brandon region, which contains some people who happen to work at that business, and then we do see that there's a lot of gatherings, a lot of multifamily households and things that can contribute to that large cluster.
In regards to the tightening restrictions beginning tomorrow, maybe you've already answered this, and sorry if that's the case, but public places, mass, are going to be mandated. Does this mean municipal buildings and public parks, but not necessarily private businesses or restaurants? Is that accurate?
No. So anything that's really accessible to the public, that's there. So certainly not private residences, but and in say for restaurants, there of course are provisions where if you're seated, and following the normal physical distancing, then you're not going to have a mask on while you're eating. So there are going to be those type of exemptions from it. But yes, it will be include retail outlets. Yes.
The numbers in the release are correct.
Except for the hospitalizations, right?
Lisa, 7 of them.
Yeah, 7 hospitalizations, 1 in intensive care, that's part of the 7. 356 active cases, 576 recovered.
Minister Friesen, so Manitoba is obviously moving forward on its plans to, reopen things back up, get the economy working again. What would need to happen for that to slow down, or for the government to say we need to put things on pause, perhaps we need to look at more restrictions, or is the reality that, we're going to have cases, it's going to be around for a while, there's going to be these clusters that pop up, and that's just part of the plan, and we got to continue to move forward?
It's a balancing act. We're constantly working with a broad array of individuals, listening to the advice of public health to be able to chart what that path ahead looks like. Obviously, as Dr. Roussin has said, we're not going to be defensive and to be changing broadly our direction with every hiccup that comes along. We do need to learn to live with the virus. But look, we've got a more sophisticated ability now to report where cases happen, which will help us. We just very recently moved to this new pandemic response system, whereby we can open permissions or rescind permissions on the basis of evidence. I think that is the roadmap for how we do this thing well. It's that ability to respond well in a community, and then for public health to give advice that won't bring, for instance, a blanket prohibition across the province, but can look at where things are happening. And I think that what's happening in Brandon right now is exactly that first foray into this ability to take a more nuanced view of how to keep us moving forward.
Dr. Roussin, obviously there was a high case count reported recently, another high case count reported today. Last time I checked, in terms of per capita, Manitoba is maybe only behind Alberta in terms of positive cases right now. I imagine that's going to have some folks worried. How worried should Manitobans be right now? And is this situation, under control, as good as we can perhaps get it under control?
Yeah, I mean, I think that Manitobans have and will need to continue to respect this virus, and so we need to ensure we're taking all the precautions that we need. Again, the total case counts is not the greatest thing to get focused on. We don't have a lot of a strain on our healthcare system right now. We notice that a lot of what goes into those total case counts are clusters or known transmission chains. So I think that we have to get used to seeing this virus. And we really want to avoid that situation where we have these harsh restrictions in place every time we see the virus, because we're going to see it for a year or two. I don't think we can have these harsh restrictions on for that duration of time. And I don't think we could just keep putting them on and lifting them off and putting them on and lifting them off. We have to be able to deal with this virus without these prescriptive measures, knowing, of course, that if absolutely required, we will, and what we've done in Prairie Mountain Health is an example.
I've been hearing from a lot of friends and family friends that there's not enough testing sites in Winnipeg, or drive-through specifically. Is there any plans to increase that?
And I'll speak to that as well. Yes, it's constantly under evaluation. In order for us to have a success story, we need to do a lot of things right simultaneously. One of them is the testing daily that we're doing in labs. That's been a big success story. We're doubling right now from just a few weeks ago what we're able to put through. But as you say, then one limiter can become the number of screening sites that we have in community. We announced recently that even the plans to take the Main Street drive-through site offline had been reversed. We thought otherwise. We conveyed the message we needed to keep that site. Right now, we have charged the regional health authorities with the responsibility to be assessing their capacity, not just for now, but for the longer haul, and thinking strategically about where those sites should be. This is of keen interest to me as the minister. We have to make sure that we have all those linkages in place, screening sites, the ability to test, and then the capacity of public health to find these people, report the results, and then to help them stay home.
Flu season's coming up. Is there a worry that is going to perhaps lead to a greater burden on the healthcare system, that it perhaps might tax the testing centers that already exist, and what are the plans that are in place to mitigate any potential concerns there?
So respiratory virus season comes every year, and almost every year does put an increased strain on our healthcare system. So, you know, I think on the good side of that, a lot of the measures that we have that reduce the transmission of COVID also reduce the transmission of those other respiratory viruses. So we're not just focused on COVID. We know we're going to see increased respiratory virus illness. And this is what we've been messaging now, is that when we're advising people stay home when you're ill, we need to prepare for absenteeism rates that we probably haven't experienced before, because we need people to stay home when they're ill. And so we're expecting to see increased respiratory illness. If you look at some of the jurisdictions in the southern hemisphere, you see low impact flu seasons, and it's likely related to all the precautions that they have for COVID-19. But we're going to certainly prepare to see widespread respiratory virus transmission that we normally see during that time.
In terms of absenteeism, I know that one policy many workplaces have is that if someone is sick, maybe more than 2 days away from work, they got to go to the doctor's office and get a doctor's note. I mean, amid a pandemic, it seems like it's probably not a good idea. Would it be your suggestion that perhaps employers look to temporarily put that policy on hold?
That's what we were saying about looking to reduce the burden on employees. So employers don't want ill employees coming to work, because you're going to have many more ill employees then. And so you want to do whatever you can to limit the burden, to make it easier for Manitobans to stay home when they're ill. So yes, and then on top of that is that we expect our healthcare system again to be pressed like it is most times, and so we don't need to press them further just for the need of medical notes.
Sorry, just one more number clarity. Is it 42 or 45 in communal living?
42 is the number that, I'm sorry, 47. So 47. So I said, yeah, 47.
Thank you. Thanks, George.